Everyone, my name is Emma, aka the Naked Doula, and today I'm going to be talking about the importance of perineal massage and how it can make a difference to your birth experience. So what is the perineum? What even is that? So the perineum is the muscle and skin between the vagina and the bumhole. This is part of the stretching process when it comes to your baby crowning and being born. So if we think about our vagina wants to be able to stretch and to feel supple. And again, the perineum wants to work with this, okay? We need this to work together to open up, to stretch and allow our baby to come into the world. Now, let me just stop you in your tracks just a second because we need to remember a few key points here. Firstly, our baby's head isn't a watermelon. It is not a solid watermelon. It is a beautiful molding head that moves and molds down the birth canal. So please don't fear and think that you're going to be birthing a big fat watermelon with no flexibility and no movement, because that just doesn't make sense. Your baby's head, your baby's skull moves and molds, and it is wonderful. So when you're birthing your baby, these things work together. Your baby's head moves and molds, and your vagina and your perineum open and stretch, unfold, unstretch to allow our baby to come into the world. So we want to be working on these specific things to ensure we are helping our body and working with it, not against it. So first things first, we need to ensure our hands are nice and clean. We don't want any bad bacteria working its way up the vagina to your cervix. So clean hands to start. Secondly, we want to make sure we are comfortable. No one wants to be awkwardly massaging their perineum and vagina. Let me tell you, we want to be in a comfortable position. Maybe for you, that's laying down. It might be on your side. It might be getting your partner involved. Who doesn't love a bit of intimacy and a boost of oxytocin? And also, if none of them work for you, that's okay. I'm here for you. I know how difficult this is. So maybe you'd like to try something different. Popping your foot up on the toilet seat so that you are in a more step position. That can also help you reach the perineum area. Now you would see from the video here that there is 2 thumbs involved. Now, if you can use both of your thumbs, fantastic. If you can't, do not worry. It doesn't matter if you just use one, that's absolutely fine. So perineal massage then. Here's a little bit of a video and you can see here exactly how it works. And yes, we are going to be putting our thumbs inside our vagina, but don't panic. This isn't a little play session. This is all for the good of your perineum, all for the good of the vagina this Christmas. What do you use then? Because no one wants to be massaging any kind of area dry. We don't want any dryness. We want something which is going to be safe to use. We want something which is going to give us good lubrication and something that feels nice. And this is where Nessa Organics come in. Oh, Nessa Organics have been my favorite from the very beginning, and I completely and utterly recommend them all the time. So much so that I've actually included their Vaginal Victory Oil in my Christmas boxes for my customers this year because they are just amazing. So Vaginal Victory Oil, of course it's amazing because it says the word vagina on it, and vaginas are amazing. And inside they have a wonderful little bottle here which contains some oil. Now this oil is safe for your intimate areas, okay? This is specifically made for perineal massage. It's made for dryness within the area, and it is also made for afterwards as well, in those postpartum periods where you may need to use it to massage a scar from a previous birth, or maybe you want to use it for a graze or a tear that did happen in your birth experience. This is what I recommend. It is completely natural, it is completely organic, and it is just wonderful stuff. We don't want to be putting anything near our vulva, near our vagina or perineum, which is scented, which has artificial products in it. We want to steer clear of all these things because it can really mess with the pH balance of our vagina. So, Vaginal Victory Oil is what we want to start with. So I give it a bit of a shake first. And you want to be using 3 or 4 drops of this onto your tips of your fingers. Now, we want to be using the oil and massaging. We want to be only keeping this on the tips of our fingers and our thumbs. We don't want to be rubbing it into our hands because we're not going to be using our hands to massage our vagina. We're going to be using the tips of our fingers and our thumbs especially. So using the tips of our fingers, we're going to massage the oil into the perineum area, into the inner labia area, and then we are going to take our thumbs and we are going to place them just inside the vagina on the back of the vaginal wall. Now, we are massaging the bottom area, the perineum, okay? We're not trying to go up inside the vagina. We don't want to do that. We just want to use our thumbs to massage this area here. And you can see from the video that your thumbs are only ever slightly inside the vagina, and we are going in this nice sweeping motion, okay? Now, you can do this for 5-10 minutes a day. You may only want to do it a couple of times a week. The more that you practice this exercise, the more supple and flexible that muscle will become. So we want to be doing this from 34 weeks. Don't panic if you've gone past this point. Don't even panic if you are about to give birth. It still helps and it all makes the difference. What about then when it comes to the point of giving birth? What other tips do I have for you? Of course I have the tips, of course I do, and of course I'm going to tell you, because we want to ensure we are giving our perineum and our vagina and our vulva the best possible chance of being safe and happy during our birth experience. So one of the top tips that I always talk about is floppy face, floppy fanny. And that is because we hold so much tension in our jaw, so much tension. And this tension affects our pelvic floor. They are connected by ligaments from the top here all the way down to the tailbone. So let me tell you, when we are birthing our baby, if we are like this, we are increasing our chances of perineal trauma, and we want to avoid this. So we want to be thinking about soft, relaxed face and jaw, pursed lips, relaxed mouth, floppy face, floppy fanny. And if you can remember this mantra and say it again and again over to yourself, I promise you it will make a massive difference to when you're birthing your baby. And last but definitely not least, when we are in this pushing phase of birthing our baby, now obviously we are programmed to think that when it comes to this point, we have to be taking hold of something and really squeezing, pushing our baby out. But this again increases the chance of perineal trauma. I want you to first listen to your body. When are your contractions coming? When are they not? because nobody else knows this better than you, okay? You're the only one feeling it. So work with the uterus, not against it. Those pauses that you may have in between are there for a purpose. They are there to help the skin and the muscle stretch, okay? They are there to help you. I also want you to think about how you are working to push your baby out, because pushing, we don't want any forced pushing. We don't want any holding our breath or gritting our teeth or tensing our whole body, because again, thinking about those muscles, when we are tensing them, we are working against them. And it's almost like taking a piece or elastic band, for example, or a piece of paper, and we're holding it really tight. There is more chance of it breaking, of ripping, of tearing. When actually, if we keep it supple and relaxed, it's got the ability, it has the ability to stretch and to mold and to move. And this is what we want to achieve. So instead of pushing down in this forceful manner, we want to take a nice deep breath in and then push our breath down the body. So we are pushing, but we are not forcefully pushing. We are taking a breath and we are pushing it down the body, down the diaphragm, onto the uterus to help bring our baby into the world. So one more time. Thinking about our face and our shoulders and breathing our baby out into the world. To summarize, perineal massage. This is important from 34 weeks and is proven to make a difference and reduce your chances of tearing during birth. I recommend that you use Nestle Organics Vaginal Victory Oil, which again is a beautiful product. It is natural, it is organic, and it is safe for your intimate areas, which is most important, especially in pregnancy. Secondly, we have our floppy face, floppy fanny. This is super important because this could be the difference between tearing and not tearing. Being able to utilize this floppy face and this floppy jaw to allow our pelvic floor to relax is going to help us open, unfold, and stretch. And thirdly, we don't want to be pushing with force. No gritted teeth, no holding breath. We want to be working with our uterus, not against it. This helps our perineum, it helps our vagina, and it works in harmony to help bring your baby earthside.